like an apocalypse, a phenomenon around the globe, impacting pretty much everyone everywhere at the same time. The Great Lockdown robbed us of our freedoms and our daily lives. Shops, restaurants, playgrounds, schools, all closed. Personal contact was prohibited. Millions of people were locked in their homes for weeks on end. Some say it came at a huge economic cost, but saved millions of lives. Others suggest the burden was so great, it actually cost lives.
There is no glory in prevention. Germany's chief virologist Drosten on the steps taken to slow the spread of the coronavirus. Medical experts weren't popular in some places, even though they may have saved millions of lives. That's the conclusion of a new study in the journal Nature. In a moment, we'll ask an expert how effective quarantine was. First, let's run the numbers.
The lockdown saved lives. That's the finding from Imperial College London. Researchers there created a model of what would have happened if nothing had been done to contain the pandemic. No quarantine, no shutdown of public life. They examined several European countries. They didn't look at the infection rate, though, but the number of deaths, which the researchers said was the key measure of effectiveness. That's because deaths are reported in roughly the same way across Europe. Infection numbers, on the other hand, are less certain. The reporting systems vary and follow different standards. Death numbers are much clearer. They are tallied quickly everywhere. Britain can be compared easily with two European neighbours, Italy and Germany. They are countries with similar sizes and structures. How many people would have died if the coronavirus had been left to run its course? The numbers the researchers came up with are startling. 670,000 people would have died in the UK. In Germany, that would have been 570,000. And in Italy, 500,000. The experts emphasize that these are hypothetical values based on mathematical models. In the real world, people would have taken steps to protect themselves, no matter what the government did. But it shows that the lockdowns and school closings had an effect and are still having one. Without them, many more people would have died. Here's how things have turned out. As of last week, in Britain, nearly 43,000 patients had died of COVID-19. In Italy, that was nearly 35,000. But in Germany, there were just under 9,000 dead. The Imperial College scientists say the British death toll could have been much lower if steps had been taken earlier.
The epidemic was doubling every 3 to 4 days before lockdown interventions were introduced. So had we introduced lockdown measures a week earlier, we would have reduced the final death toll by at least a half.
So prevention is crucial, but early intervention may be the key to saving lives.
Good afternoon.
Tobias Kort is an epidemiologist and director of the Institute of Public Health at the Charité Hospital here in Berlin. Thank you very much for being on the show again, first of all. When we look at those numbers, Britain, Germany, Italy, all very different scenarios there, but what do these numbers actually mean?
First of all, one has to understand that the underlying population is different. So the population size. So just looking at the absolute numbers is difficult because the size of the population in these countries are different. Then obviously also the classification is different. So what do you call a patient who died from COVID-19? What is the test strategy? And so comparing countries is not as easy, but the broad picture is very obviously that the strategies differed and the reaction and possibilities of the healthcare system also differed, which may have explained some of these differences.
What about when it comes to Sweden, a relatively small country? A sweeping lockdown didn't happen, but they had a higher number of deaths.
Yes, they had a high number of deaths relative to the population size, which may indicate that the strategy may not be optimal for Sweden, but the officials there and the scientists are watching the situation very carefully and trying to react according to the Swedish system.
What do you think is coming our way? A second lockdown? Is that conceivable?
It's certainly conceivable. Right now, the numbers are rising in several countries, dramatically rising. And several states, for example, in the United States, after lockdown have opened up and now see a dramatic rise and a substantial burden for the healthcare system. So I think at least on the local level, a second lockdown is very likely until we have a medication or a vaccine available to treat COVID-19.
What's that going to mean, though? If a second lockdown comes out?
It means that, first of all, COVID-19 happened locally in regions, so not on a country as a whole, but always in regions. So the lockdown that we had during the first wave, so-called first wave, affected mostly countries, or state levels. And so hopefully by now we have measures in place that will allow us to, if necessary, have lockdowns on a more regional, more smaller level, so just a city or like a village or like a very small region rather than a state or a country. That's what I mean when I say we hopefully have measures in place that will allow us to react more flexible.
But does it mean opening up, closing down over and over? I mean, can't that go on forever? Or, at some stage, we're going to have to come to terms with the reality of living with this disease.
Absolutely. And the reality is that the virus is still there and we're trying to open up. And the issue is, of course, we have summer, the weather's nice, people go outside and they forget that the virus is there. So wearing masks, particularly if you go inside, wearing masks is very important, keeping the distance, then testing, tracing people, isolating people who have been tested positive. It's very important. And not all countries are ready to actually conduct these measures. That's why the ultimate solution then is, unfortunately, then a lockdown.
You heard it from Tobias Kort, epidemiologist and director of the Institute of Public Health at the Charité here in Berlin. Thank you. And let's check in with our science correspondent, Derek Williams. He's been busy researching the answers to your questions on all things corona-related.
Can someone who has been infected and cured of COVID-19 be reinfected?
I've answered this a couple of times over the months, but it's one of those topics that needs regular updates, especially in light of a couple of recently published studies showing that antibody levels are dropping off in a pretty big way in a lot of people who had COVID-19 within 3 months of their infection, especially in those who were asymptomatic. Now, antibody levels, it has to be said, aren't the only factor to play a role in long-term immune response. But still, this isn't positive news when it comes to our hopes that getting COVID-19 will stop you from getting it again for at least a year or two. That said, over 6 months into the pandemic, there's still no clear-cut evidence of someone being infected again after having already been through the disease once.
How likely is the transmission of influenza on airline flights?
To find out how dangerous flying could be potentially in the COVID-19 era, it's a good idea to look back at research in planes that we've done in the past on the spread of viruses like influenza. Now, the WHO says transmission of infectious pathogens happens mostly between people seated in the same area on the plane. So the risk is highest within those few rows, but it concludes that the risk is otherwise no higher than it is on a train or a bus or in a theater. But I tracked down a meta-study from 2016, and one of the interesting things it had to say was that research on the topic really doesn't always agree, and that our data is not really that robust. So to be truthful, it looks like we still don't know really exactly how likely pathogen transmission is on a plane, just that it grows more likely the closer you sit to the infected person.
What lessons are being learned to prevent the next pandemic? How are they being compiled and disseminated?
I think there are many lessons to be learned or maybe relearned from this pandemic. One is that we need to be more prepared for when this happens again, and sooner or later we know it will. Another is that transparency and acting fast, especially in the early stages of a novel pathogen outbreak, is absolutely vital. Unfortunately for us humans, lessons learned often don't necessarily translate into lessons retained. When it comes to compiling and disseminating learned lessons, it seems to me that the World Health Organization would be a natural repository. But at the same time, the mistakes the WHO has made in the course of this current pandemic have revealed some pretty deep flaws. In my opinion, the organization needs reforms that not only give it a clearer mandate, but that also give it the means to carry that mandate out. Because next time, we really have to do a better job at coordinating an international response.